Hello everyone, my name is Dr. Gopal Thakur, Associate Professor in HOD, Department of Journalism and Mass Communication, Tecnia Institute of Advanced Studies. Today is a very interesting topic and topic is health communication and public health. Health communication. It is an essential part of human life. All meaningful social interaction can be labeled communication. Without communication, an individual could never become a fully functioning human being. Reading, writing, listening, speaking, viewing, and creating image are all acts of communication. There are also many more subtle communication activities that may be conscious or unconscious. These include expression, gesture, and body language through communication. People transfer facts, ideas, emotions, knowledge, attitudes, and skills to make informed decisions about their health. Now, question is health communication. Health communication is the art and techniques of informing, influencing, and motivating individuals or larger audience about important health issues based on scientific and ethical considerations such as public health and health education. Different elements of health communication. Initiation action. Second one is make needs known. Third one is exchange knowledge, attitudes and practices. Next one, demonstrate the benefits of behavior change to public health outcomes. Next one, help people understand issues and may change their health beliefs. Establish and maintain relationship with health providers. According to the WHO, health communication is recognized as necessary part of efforts to improve personal and public health. Now, question is arising, what is the public health? Public health is defined as the science of protecting the safety and improving the health of communities through education, policy making, and research for disease and injury prevention. But according to WHO, World Health Organization, public health is defined as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. World Health Organization, WHO began when our constitution came into force on 7th April 1948, a date we now celebrate every year as a World Health Day. We are now more than 7,000 people working in 150 countries, offices in 6 regional offices at our headquarters in Geneva, Switzerland. It covers 3 key areas. First one, health protection. Protection against infectious disease and environmental threats. Second one, health improvement. Target individual behavior or promote health by education, legislation. Next one, healthcare services provides, analyze and improve, optimize healthcare service. The aim of public health is very simple, the process of mobilizing and engaging local, state, national and international resources to assure the condition in which people can be healthy and focus on entire populations, not an individual patients or disease. Present form of public health in its present form is the combination of two. First, scientific discipline. Second, skills and strategy. First, scientific disciplines that includes epidemiology, social sciences, health education, medical sciences, demographic, biostatistics, skills and strategy, epidemiology. Second, investigation, planning and management, intervention, surveillances and evaluation. Epidemiology is a tool often used in public health. It is a science analyzing the incidence, distributions, determinations and control of disease, health problem as well as factor promoting health. Demography is another tool often used in public health. It is the study of the size, structure and distribution of human population and the factor influencing these attributes such as fertility, mortality and migrations, but also population health. there are three main public health functions are: first, the assessment and monitoring of the health of communities and populations at risk to identify health problem and priorities. Second, the formulation of public policies designed to solve, identify local and national health problems and priorities. Third one, to assure that all populations have access to appropriate and cost-effective care, including health promotion and disease prevention services. Public health professionals monitor and diagnose the health concern of entire communities and promote healthy practice and behaviors to ensure that population stay healthy. Example of the notable public health campaign are: first, vaccination and control of infectious disease, motor vehicle safety, safety workplaces, safer and healthier food, safer drinking water, healthier mother and babies, access to family planning, and coronary heart disease and stroke resulting in declining death rates. Recognition of tobacco use as a health hazard. The term global public health recognizes that as a result of globalization, forces that affect public health can do come from outside the state boundaries, and that responding to public health issues now require attention to cross-border health risk, including access to dangerous products and environmental change. Public health care functions and 10 essential services. First, core function 1, assessment. Assessment means collecting and analyzing information about health problems. And essential services 1 is monitoring health status to identify community health problems. Essential services 2, diagnose and investigate health problems and health hazard in the community. Core function number 2, policy development. Broad-based constitutions with the stakeholders to weigh available information and decide which interventions are most appropriate and ensure that the public interest is the service by measures that are adopted. Essential service 3, inform, educate and empower. Inform, educate and empower people about health issues. Essential service 4, mobilize community partnership to identify and solve health problems. Essential services 5 is develop policies. Develop policies and plans that support individual and community health efforts. Core function 3. Core function 3, assurance. Promoting and protecting public interest through program events, campaign, regulations and other strategy, and making sure that necessary services are provided to reach agreed upon goal. Essential services 6, enforce laws and regulations that protect health and ensure safety. Essential service 7, link people to needed personal health service and assure the provision of health care when otherwise unavailable. Essential service 8, assure a competent public health and personal health care workforce. Essential services 9, evaluate effectiveness, accessibility and quality of personal and population-based health services. Essential service 10, research for new insights and innovation solution to health problem. Public health fundamental, 5 pieces of public health fundamental is 5 pieces. I am talking about the 5 pieces. First one is a prevention, individual and community focused. Second one is a promotion, voluntary and education advocacy. Third one is a protections, policies and regulations and enforcement. Fourth one is a population based on communities and groups. And fifth one, last 5, preparedness, bioterrorism, natural disaster, pandemics. So different phases of public health. First phase, disease control phase, 80s to 90-20, review of sanitation practices. The first phase of public health following soon after the industry revolutions, advocated sanitary action to deal with healthy problem caused by environmental factors. And second, sanitary legislation and sanitary condition reform, garbage refuse and sewage disposal, supply of drinking water, disease and death control, gives positive result, that is improve the health of people. And second phase is health promotion phase, 1920 to 1960. In addition to disease control activities, one more goal was added to public health, that is a health promotion of the individuals. It was initiated as personal health services such as introduction of mother and child health services, school health services, industrial health services, mental health, rehabilitation services, and third phase, social engineering phase, 1960 to 1980s. Social engineering behavior aspects of disease and health were prioritizing to lessen chronic disease burden on the society. The concept of risk factor came into existence like age-wise, gender, heredity, faulty eating habit, sedentary lifestyle, addiction, obesity, stress. And the fourth, health for all, 1980 to 2000 AD. In 1977, it was decided in the World Health Assembly to launch movement known as Health for All by the year 2000. The member countries of WHO at the World Health Assembly defined health for all as attaining of a level of health that will enable every individual to lead as socially and economically productive life. To establish health for all by 2000 AD. AD means Anno Domini, which is Latin word, and the year of God, you can say that, year of Lord, and it means the number of years since the birth of Jesus Christ. And that is totally based on the religion. So, health for all by means of primary health care. It means health gap between the rich and poor within a countries, between countries should be narrowed and ultimately eliminated. Concluded that the neglected 80% of the world population to have an equal claim to health. Protect from killer disease of childhood like ARI, measles, jaundice, pneumonia, and primary health care for mother and children, 10 achievements of public health. First one, vaccination. Second, motor vehicle safety. Third, safer workplace. Fourth, control of infectious disease. Fifth, decline in death from coronary, heart disease and stroke. Sixth, safer and healthier food. Seventh, healthier mother and babies. 8, family planning. 9, fluoridation of drinking water. And 10th number is recognition of tobacco use as a health hazard. I think you like this lecture, and this lecture is totally based on health communication and public health. So, dear friends, world cannot change, and the day you start changing, world will also change. So, you can like, subscribe the Tecnia TV. Thank you so much.